Um, okay, folks, welcome to Dow Labs webinar. We're calling this Back to Basics, and this webinar is on chronic pain. My name is Dr. Eric Karchmer. I'm the Chief Chinese Medicine Officer at Dow Labs. And I'm delighted to speak to you today about chronic pain. And I'm going to share with you some things today that I can pretty much say I'm positive you've never encountered. This is materials. This is some things I've learned during my training in China from a very unique doctor, but it's extremely important and, in my opinion, absolutely essential to treating chronic pain. So let's begin. So today, just a quick outline on what we're going to be doing today. First, we're going to talk a little bit about what is chronic pain, and then we're going to get to sort of like the key question or the key questions maybe you have to ask in order to understand how to treat chronic pain. And as you'll see, I'm going to really outline for you what I think there are sort of two basic types of chronic pain that we encounter in our clinical situations. If you understand these two types of chronic pain, if you know how to distinguish the two, it will transform your clinical practice. One type of chronic pain, as you'll see, is going to kind of involve what's might be known as Jinjin therapy, or the tendinal muscle meridian therapy, or sinew channels. There's lots of translations for that term, Jinjin. I'm going to talk a little bit about that. And then there's sort of more kind of classic B obstruction. And I'll explain that to you and how we can treat that. And I treat these two things very differently. I'm going to give you some diagnostic tips on how to distinguish the two and some treatment strategies as well. And we'll talk a little bit about how to use our formula joint fatality, which is so useful and so important for treating that second one, the classic B obstruction. And then we'll talk about some upcoming webinars at the end. Great, okay, well, let's get into it. So first, what is chronic pain? You know, sort of classically defined in biomedicine as pain that lasts longer than 3 months or the reasonably expected healing time from you know, an injury of some kind. Now, there's many causes to chronic pain. There can be musculoskeletal disorders. We'll definitely be talking about that today. Neurological disorders as well. That may include some things we're talking about today. Gastrointestinal, reproductive disorders. That's probably not included in what we're talking about today, but there's also many other causes. Pain is sort of one of the most common symptoms we see in clinical practice. But we're going to try to distinguish between kind of two very important types of chronic pain in Chinese medicine. Let's get a little further into that. So one essential concept that we need to understand to think about chronic pain in Chinese medicine is this concept of B in Chinese medicine, a B syndrome. Sometimes it's called blockage or obstruction. And this is an extremely important, extremely useful concept for thinking about chronic pain. Blockage or B syndrome or obstruction occurs when the channels become obstructed and qi and blood do not flow freely. Now, what causes that obstruction? Classically, it's going to be wind, cold, and dampness, but also sometimes heat. And the deficiencies themselves don't necessarily cause the obstruction, but they can work in complicated ways with these other pathogens to really make it a difficult problem to treat. Okay, we're going to get into that a little bit more in a second. So for me, though, I like to, and this is my personal practice, but I've just found it absolutely essential, and this has been kind of my bread and butter, if you will, in the clinic, treating chronic pain, is a couple questions you want to ask. So first, when a patient comes into your clinic, you want to rule out chronic pain caused by a primary medical condition. So, you know, if it's menstrual pain or something like that, we want to treat those problems. So if the pain is really secondary to something else that's going on, then yes, your focus needs to be on what is that primary condition. And frequently patients that come into our clinic will come in with a diagnosis. They've probably been to see a lot of doctors already. Anyone who's in pain is going to be in search of some answers typically. However, then you want to ask what I can, but frequently what's going to happen too is you'll have many, many patients who come in without a good diagnosis, without a clear explanation for why they have common pain. And then you've got two questions to ask. And if you understand the distinction here, your clinical practice will be transformed. So first, is the pain a soft tissue injury? In other words, is it an injury to the muscles, tendons, ligaments, a cartilage, what have you? If it is, it will require one kind of treatment. And for me, that's usually going to be acupuncture. Or is the pain in the joints? Now, it doesn't have to necessarily, and is it caused by wind, cold, and dampness? In other words, is it more of our classic kind of B obstruction? Now, that pain may not be limited to the joints, but typically the joints is where we more often see that classic B obstruction. So if we can make a distinction between if we can ask these two questions, so we know how to ask them and we know how to get our answers, your practice will be transformed, and you'll have two very different approaches on how to treat chronic pain, and your clinical results will improve immensely. So I'm going to talk about that first one, the soft tissue injury. And here I'm referring to the work of Professor Sri Li Gong. He's a professor I got to study with while I was a student in Beijing back in the late 90s. He's been a real pioneer in Jinjin channel therapy, or tendinomuscle or sinew channel therapy. And I happened to meet him kind of just through some coincidence, but when I did, he was in the middle of writing this book you can see here on the screen. And I didn't quite know it at the time, and I didn't even fully appreciate sort of how innovative his research was, but it's ultimately sort of transformed my clinical practice, and there's nothing more important to my clinical practice really than his Jinjin channel therapy. Now today's webinar is not going to be a webinar on his channel therapy. It's going to give you a few of the basics, but but I'm really I'm planning sort of a future course on it for some CEUs, and that would be the only way to kind of really get into the finer points of it. But nonetheless, some of the basic principles that I want to share with you from Jinjin channel therapy, from sinew channel therapy, will nonetheless be really important in your practice. So I'm just going to give you a couple basics on the Jinjin channels, the sinew channels, and some diagnostic tips here. And this will, I think, be extremely important in your practice. One of the sort of insights of Professor Xue is that the Jinjin channels aren't what we've typically been taught as sort of a subsystem, a subset of kind of a complicated system of channels, where we start with the 12 major meridian channels, and you've got your lower, and you've got the Jingbia and other channels. Instead, there really should be an independent, separate system channel. Now, here, this gets into the technicalities of how you read the Yellow Emperor's Inner Canon and how you understand it. But just sort of tuck that away as an important fact here. You just have to sort of accept it for the moment. But he really argues they're not a subset of the 12 major meridians as we typically think they are. And normally when we learn the stuff in school, we just get a couple classes on it, but we don't know anything about how to treat them. His life work has been sort of developing therapies for the Jinjin channel and for really understanding what they treat. He does reference Zhang Jiebing or Zhang Jingyue, who some of you may be familiar with. This is a famous Ming Dynasty doctor. And Zhang Jingyue or Zhang Jiebing's statement on the Jinjin channels, on the sinew channels, he finds quite accurate and sort of true to his understanding and his reading of the inner canon. So I'm just going to read you a little quote here, and it sort of, he sort of backs up his point about this being a separate system. So I've made a little translation here. And so Zhang Jie being asked, this is kind of in the 16th century, why are there also the tendinomuscle channels exterior to the 12 major channels? The 12 major meridians. The major meridians, I'm sorry, I'm using meridians and channels interchangeably here. The 12 major meridians flow between exterior and interior, and therefore move in and out of the organs according to their order. The tendinomuscle meridians bind the skeleton. They therefore envelop the whole body and fix it in position. The 12 tendinomuscle channels all begin at the fingertips, thicken at the axillary bones, bind at the wrists and elbows, and here we might add ankles and knees, attach at the joints, connect to the muscles, rise up to the neck, and end at the head and face. So as you can see there, these kind of give you a couple of summary points here. They're really quite different. They, as we so we know that the pathways are somewhat similar to the 12 major meridians, but they all start at the fingers and toes. They all travel to the head, up into the abdomen. They don't connect to the inner organs. And this term bind is very interesting. They sort of bind at the joints. The joints are going to be important. They're going to be important here. Again, we'll make a distinction between our classic reason in a second. So one interesting insight that Professor Xie has is that the Jinjin meridians, the sinew, the tendinomuscle channels, one way you might think about them is as they describe as much a channel as they do sort of a pathological process, because most soft tissue injuries sort of progress along those channels. They move up and down them. So these injuries tend to grow and develop, and there tends to be sort of a progression to them. So here, let me just give you a quick little insight. So some of you may be familiar with perhaps this image here. This is the foot taiyang tendinomuscle meridian, or sinew channel. And you can see it starts at the foot and goes up the back of the leg and up into the head. This drawing is pretty interesting. And you can see it's not drawn as a line. It's drawn, something more akin to muscles, but it's not exactly the anatomical muscles. And the pathways are similar, but not quite the same. If we were to take that sort of point about pathological process here, you might, so this is a very important meridian for treating lower back pain. According to Professor Xie, then the argument might be that lower back pain sort of might kind of progress along these channels. And here it could progress in both ways. So it can start in the lower back and kind of move up into the upper back, kind of along that channel. And that's roughly along the paraspinal muscles. Or it might move down into the hips and into the back of the legs. We often see that. And it turns out many of us don't know this, but this would be a key point when we treat lower back pain. It's often essential to be treating also in the hips as well. So, but for our point, what we want to do, and for those of you who aren't familiar with this treatment strategy, one of the key things you want to be doing is sort of like ruling it out for your patient so that you can maybe get to something like joint fatality and an herbal formula that's going to work for you. What's important here is that you can do palpation. So you can palpate along the tendinomuscle meridian, the sinew channel, and you're going to palpate for tenderness and tension and knots and tightness and other abnormalities in the soft tissue. As you get sort of practice at this, you're going to find quite clearly that there's things that don't feel good are often quite tender to the patient, that feel sort of abnormal, don't feel like nice, relaxed, soft muscle tissue are going to be often the areas where these injuries are. One really important thing sometimes to think about, however, is really noticing where the muscles and tendons attach to the bones. So these attachment points, and some of you may kind of be familiar with looking at attachment points more from things like trigger point therapy and stuff like that. These are going to be key areas of injuries for Dr. Xie. One key point though is that these attachments, when you're actually palpating, you'll see you're going to be maybe close to the bone, right on the edge of the bone, but you're not actually kind of in the joint. And so it's the injury then is kind of, you'll get practice at this, but you'll notice the injury is really in the tissue, the soft tissue, not in the joint. If you find these kinds of tensions and tightness, you're really finding indications of soft tissue injury. And then you want to kind of corroborate that through your intake. And you're going to want to ask your patients if they have some sort of chronic repetitive strain. So for example, a lot of patients who have wrist pain and from typing and or playing a musical instrument, something like that, they're often going to have a soft tissue injury, but it's going to be not exactly in the wrist. It might be up the arm. Again, that principle of following the channel up near the elbow. So you palpate near the elbow, you find that tenderness there, some down in the wrist as well, and then you find out this person has been playing piano for 20 years or 50 years, or this person has a typing job and for the last 2 years has been doing an incredible amount of typing or something like that. The combination of that history together with your findings, your palpation, your clinical findings will be the key to kind of identifying if this is a soft tissue injury. Now, in addition to chronic repetitive strain, another classic presentation would be something like an acute trauma. So think here like something like whiplash from a car accident. Whiplash patients are going to have all kinds of injuries to their neck muscles. This is this would be kind of a classic place for like a Jinjin therapy, or you really need to treat those muscle injuries. And then that acute trauma then sort of continues and lasts. It doesn't heal, in part because your everyday activities are enough to kind of continue to strain and irritate and aggravate that original kind of acute trauma. These kinds of soft tissue injuries, I can tell you that they really almost absolutely need to be treated with acupuncture. I don't think anything else quite gets to them, even massage. And again, I'll say sort of the details of exactly how to do it for a future course. But it's really an acupuncture therapy. Typically, not always, these types of soft injuries are going to be less responsive to herbal medicine treatments. And you really got to get into the muscles and deal with sort of the adhesions and scar tissues that you find there, and that's when you start to get some relief. I sometimes do combine acupuncture with herbal treatments. I'll talk about that a little bit later. For the moment, you might think soft tissue injuries, acupuncture is your primary therapy. Okay, so that's a little bit about Jinjin therapy. Let me talk a little bit about our classic B syndrome, classic blockage, diagnosis, and treatment. Now here, you're going to find something different. When you go to palpate sort of the soft tissue and the muscles, you typically don't find a lot of pain. Now, it's not absolute, but however, if you were to sort of palpate the joints themselves and really kind of like press on the actual joints, you might find those extremely tender, extremely painful. Here you're going to ask some different questions. Is there a history of rheumatological conditions? And perhaps this patient may have already seen some specialists. They may have a diagnosis of rheumatoid arthritis or something like that. They may also come in with a diagnosis of fibromyalgia. I'll talk about that in a second. That could be a bit confusing. But then we want to ask, is the pain, clearly made worse by, wind, by changing weather patterns, by cold temperatures, by dampness and humidity? All those things will help to point you towards a more classic B syndrome or B diagnosis. And when you have that diagnosis, I'm going to give you a few more symptoms here. What you're going to want to think about then is herbal medicine. So, but in here, your symptoms are going to be slightly different than what you would have in the soft tissue. You will have chronic pain is the same, and soreness, but you may also have some numbness, some weakness, some heaviness, immobility, perhaps swelling in the joints. Now you may also get it in the muscle and tendons. Again, rheumatological conditions can be kind of complicated. And then you want to sort of see what kind of history there is here too. You may not have that repetitive strain history. You probably won't have some sort of acute trauma injury. Instead, maybe aging could be part of it, like an osteoarthritis. Aging really maybe your main thing. Surgeries are something to ask about. That surgery might actually point more towards the soft tissue injury, like the trauma would. But there may also be some degenerative conditions, or just some rheumatological conditions, and all those will be really important for helping you make that distinction. Is there something that's sort of like more in the joint and just in that B, that more classic B family, the more general, more in that world of rheumatology, or is this something in the soft tissues? And the images here are just sort of to remind you that, you know, we're really talking about some inflammation kind of in that joint space. That's different than those soft tissue injuries where the joints really are fine. This brings us back to joint fatality. So joint fatality, which is 毒火鸡生汤, is a great formula if you're in that latter category, in that sort of more classic B syndrome. And to kind of review some things we've talked about in earlier webinars, you know, the explanation here for pain, especially when it sort of falls into that pattern of 毒火鸡生汤, is kind of this no free flow of qi and blood, or insufficient flow of qi and blood. No free flow means there's some sort of obstruction caused by wind, cold, and dampness. Insufficient flow is more referring to a deficiency of qi and blood. And we want to recognize, especially chronic joint pain, as a sign of deficiency, as a vulnerability in our bodies that allows those external pathogens, wind, cold, dampness, potentially heat, to invade, to attack the joints and cause chronic pain. So 毒火鸡生汤 is by no means the only formula for treating sort of our classic B syndrome. But it is a great one, and it's somewhat unique in that it really has a focus on addressing the problems of deficiency, and it's the herbs in this formula help to treat liver and kidney deficiency. They treat qi and blood deficiency, and at the same time they have herbs to drive out wind, cold, and dampness. So this is something you might consider for like a postpartum pain. Here you can think the deficiencies of the postpartum state allow for wind, cold, and dampness to invade. Fibromyalgia, which I just mentioned above, is actually a really interesting problem to think about here. So I think, and actually just when I say, maybe I should just include arthritis too. So you're gonna have patients come into your clinic and they may have been told by their MDs that they have fibromyalgia or that they have arthritis. We just wanna recognize that a lot of doctors may use those terms pretty loosely. In part because they don't have great solutions for them, and we do have like great solutions for them in Chinese medicine. And fibromyalgia itself is just kind of a catch-all term. In my practice, I would say a percentage of fibromyalgia patients, when I really check them out, I really find these are just some soft tissue injuries, but they're just a little bit more extensive perhaps than we might normally see. It's not just a wrist pain on one side, it just happens to be in a number of areas. And so it looks like a more generalized thing, and that's why we'll get that label. And likewise, arthritis might be something similar. So for example, I'd like to speak of a current patient. I've got a patient with some lower back pain. He came to me sort of saying he has arthritis. What I've kind of found is that in his case that he both has like a lot of the soft tissue injuries, all the palpations that I mentioned up and down that sort of sinew channel, a lot of muscle tenderness in there and a lot of tension and knots in the muscles. But he also does have some arthritis in the vertebrae and those vertebral joints as well, and that's kind of been confirmed by X-ray and things like that. So that's actually a patient where I've used both acupuncture and herbal medicine to treat. So that's kind of an important point that I want to end with here too, is that we also want to recognize these two things can come together. I tend to think of them as two basic categories, the soft tissue versus the sort of the joint B syndromes, joint injury B syndromes, but they can come together, and you just need to know that how to think about them. But when you really can be sure that it's in the joints, and it's our more classic B syndrome, joint fatality, is a great formula for addressing it, particularly with patients who are maybe middle age or a little bit older. They're often really going to present with those types of deficiencies that this formula is really designed to address. That is kind of going to be my little webinar in a nutshell. I've kind of thrown a lot of information at you, particularly in regard to the Jinjin, the sinew channel therapy. Again, hopefully coming in not too long, we'll do have a major CE presentation on that or something. But nonetheless, I think you can kind of take some of the key points from that, which is to think about, are your patients presenting with injuries to soft tissues, muscles, and tendons, or are they presenting with pain more in joint spaces? And that will help you decide between acupuncture therapies or herbal therapies. Stay in touch. Our Facebook group is getting pretty active, and I encourage you to check us out there. Our post newsletter comes out every 2 weeks, and we're going to be having more webinars now that sort of the economy is reopening, and hopefully many of you are getting back into your clinics, at least on a limited basis. We'll space out some of our webinars. Our next one will be next month. We're going to focus on dosage and concrete indications for our formulas. We haven't set a date exactly, but I think we can tentatively plan for July. Great. Thank you all, and for checking us out. Please be in touch, and if there's strong interest in that, in sort of a CEO course on the Jinjin meridian therapy, please kind of let us know, and that'll give me more motivation to kind of pull that material together for a future course. Thank you.